Hey beautiful souls, welcome back to the channel. I am Nurse Meg from nursemegRN.com and Nurse Meg RN on social media. So this video is all about how to give report. I write courses and books and make videos for nursing students and new nurses who really just need some extra support. Maybe you didn't have the world's best preceptor and there's still things that you struggle with. That's why I'm here for you. And this video is all about how to give report. I actually wrote a mini course on how to give report along with printouts and videos and the best resources for you. So in this video, I'm gonna give you one tip from each section and module. There's a ton of tips and printouts for every scenario. In this mini course, I will put a link below in the description to this course. And screw it. How about a discount code? You can use code NURSE10. I'll create this code, NURSE10, to get 10% off this little mini course. So let's get started. All right, module 1 in my course is how to initiate report. I think a lot of people get nervous. A lot of new nurses are intimidated by the other nurses and they don't own their space on the floor yet. They're still kind of finding their footing. So I have a bunch of tips on how to initiate report, what exactly to say to go up to the next nurse and be like, we're starting report. Hi, do you have my patients? Do you have rooms 14, 15, 16? All that sort of stuff. So I suggest that you always find the person. I suggest that you ask their name if you don't know their name, but let's say you do know their name. Let's say Natasha. Natasha, you have my group today. They're a great group. Are you ready to get started? Always initiate report. Don't wait for them to look not busy or to not be on the computer or for them to approach you. You got to get out of there. It's time to hand off and switch it up. So I suggest that you do that. Go up to them and introduce them. Say something a little bit about your group. Oh, you're going to love room 16. This is a great group. Number 14's family is super nice. Something positive that you can give them so that they're like, oh, okay, all right, let's get started. Meeting them with positivity is going to sort of change their mindset as well. And they're gonna be maybe more willing to all right, let's get started. I'm ready to go. I do suggest also to have printouts for them. I have a perfect report sheet. I actually give it out for free on my website. I'll put a link down below to that as well. It's a totally free report sheet that you can fill out for each patient. If you read it from head to toe or from top to bottom, I'm such a nurse. If you read it from top to bottom, it's gonna be the most perfect report that you can give. Even old crusty nurses will be like, wow, that was great, I have no questions. So that's totally free. I'll email it to you. I'll put a link down below to that as well. So if you have those printed out and filled out and you can give that to them as you're giving report, that's also another thing that the other shift will really appreciate, that you put in some effort to get ready and you have report sheets for them. And they may use them or they may not use them, but they will always appreciate them. All right, another tip that I want to give you in module 2, how to be courteous to the next shift, is to be on time and be ready. So when you are coming on as the oncoming nurse, be ready. If you do like to look up your patients and all the information and all the labs ahead of time, get there early and do that. Don't wait until the other shift is ready to give report to do that sort of stuff. Always be ready, always be positive, seek out the people to get report and don't wait for them to come to you. That's how you can be courteous for the next shift. Module 3 is how to give report. In this module, I tell you exactly what to say and what not to say, but if you download that report sheet that I talked about earlier and just read that, don't add family drama, don't add any unnecessary history, just read that, give that to them, and they'll be fine. Module 4 is all about how to talk to the doctors. Listen, doctors are just as busy as we are, but they just have a different role. So they have 30 patients that they have to see all over the hospital. They come in, they have a different rounding sheet every day. Sometimes they forget patients, they don't know the whole story. We are the detectives, we know the whole story. We are so important, but let's not waste the doctor's time. So I actually have a script of how to talk to the doctor when you are face-to-face and when you are on a phone call, like a literal script of exactly what to say. Now, when you are calling a doctor or you are approaching a doctor, I want you to have your report sheets with you. And I want you to already have information or actually have their chart open when you're speaking to them, because if they start asking questions, all right, well, what was their white count yesterday? All right, well, what was their potassium this morning? Did they get that x-ray? What did the last one show? Is there improvement? You wanna have that information ready, because if you're on the phone with them and you're like, oh wait, let me check, it's a waste of your time and it's a waste of their time. So be prepared when you call the doctor. And if you want that full script, go ahead and purchase the course with the code NURSE10 to get a discount, and you'll get printouts for every single one of these modules. I literally tell you exactly what to say in every scenario. All right, module 5 is about how to give report to other facilities. So there's a lot of things that are important for, let's say, a SNF, a skilled nursing facility, and maybe a rehab, things that they want to know and the things that maybe they don't want to know, like that are very important in the hospital, but in that setting, they don't care about. Paperwork is very important. Make sure you have all the correct paperwork to go to that next facility. There's a lot of legal restrictions when you get to those facilities. I've worked in all those facilities, and for a skilled nursing facility, you need a specific form signed by the doctor and filled out by the doctor. Also, if there's any end of life like DNR, no intubation, power of attorney, those kinds of paperwork, that needs to go with them. It needs to be like in the front of the chart. Do not forget that. It is such a hassle when you have to find that on your own. So that's another little tidbit on how to give report to other facilities. I actually do have a script as well on how to give report to other facilities like rehabs and skilled nursing. It's not the same as the hospital because they don't care about the same things. Obviously, they're not going to go with an IV. They may not have things running, stuff like that. From my perspective, from working in that facility and working on both sides, I give you exactly what to say and what they want to know and what they don't want to know. Module 6 is leaving the floor or going on break. So if you're just leaving to take a patient to CAT scan, or if you're leaving off the floor like, I'm going on break, I'm going to the cafeteria, I'm going to eat, you're leaving your patients. I have a little printout and it has lots of different boxes so you can fill it out for each patient, exactly what the next nurse needs to know. Is anything running? Are they alert and oriented? Code status. Super important to be able to find that right away if it's not your patient, and your extension so that they can call you with any changes or questions and things like that. Number 7, I know this course has a lot of modules. I said it was a mini course, but I mean, it's pretty much a whole course. Module 7 is giving report to other floors. Let's say your patient is getting worse and they need to go to a higher acuity, or maybe they're getting better and they're gonna be downgraded to a different floor. I tell you exactly what to say, exactly what not to say. Now, you wanna give them full report as if it was change of shift. So you are going to use my report sheet and read it from top to bottom. And then you're gonna tell them why they're moving. So if they coded, they were intubated, they're on pressors, and now they need to go to ICU, you would say that at the end of report. Like, what was the situation that changed? Or they're being downgraded, like they're off their insulin drip, they're off their cardiac meds, and now they're in sinus rhythm. They've been in sinus rhythm for 24 hours. Now they're gonna go to your floor. Tell them what changed and why the doctor is choosing to upgrade or downgrade them. Now there you go. Those are all the modules in my course called How to Give the Best Report. I think a lot of the new nurses that I have trained over the last 12 years have really struggled with report and how to communicate as a nurse. And that's why I created this course. And that's why I want to help you communicate better. I think it was a big gap and it kept them from doing their job the best they could. And it also kept the doctors or other nurses or other facilities or other floors from really respecting the new nurse and understanding how much skill she really had, because he or she couldn't communicate in the best way and they couldn't show how skilled and ready and how awesome they were. So that's why I created all of these resources for new nurses to communicate better, to show how awesome they really are. So again, if you're interested in this course, go ahead and go to the description and use the code NURSE10 to get 10% off. And if you have any questions on the things that I said, go ahead and put it down below in the comments so I can answer them. And I will see you on social media, Nurse Meg RN, on TikTok, on Facebook, on Instagram, and I'll see you on my blog, nursemegRN.com. So thank you so much for watching. Like this video if you made it this far and subscribe for more. I'll see you next time. Bye.